Welcome back to the Pat and Aaron Show, 95.3 WDA and AM 620. Time for our Florida Orthopaedic and Tampa General Hospital injury report. If you're dealing with an injury, reach out to our friends at Florida Orthopaedic Institute and Tampa General Hospital and book that appointment today, floridaortho.com. Joining us on the hotline now, once again, Dr. Seth Gasser. Good morning, Dr. Gasser. How you doing?
Doing great, Aaron. How are you?
Doing fantastic, better than some of these players around the league. And I want to start with the Buccaneers and some of the injuries they're dealing with, Dr. Gasser, specifically toe injuries. Now, we know Bucky Irving's been dealing with a toe injury. Now, Baker Mayfield is dealing with a toe injury. We'll get to that in a minute here, but I want to start with Bucky Irving. Coach Bowles has said it's something he's going to have to manage the rest of the season. So can you just walk us through Bucky, who's still being productive, but he's dealing with that toe injury?
So most of these guys that have kind of these chronic recurring toe injuries have what we call turf toe. And what that is a hyperextension of your big toe, and it tends to injure those structures on the bottom of your foot that connect the first joint of your big toe to your foot. And those structures get strained, sprained, or partially torn. And that can be a big problem because that's what helps stabilize your foot and let you push off. For instance, when you cut, pivot, or any of those sort of aggressive sprinting activities. And they can be really bothersome because they do that 1,000 times a game, causes a lot of pain. And it can be one of those things that can aggravate you if you have a significant turf toe for the rest of the season until you have significant time off to really let it heal.
Yeah, now we hear Baker Mayfield's dealing with a similar issue with soreness. For a quarterback, how does that impact it? Because I know, obviously, a running back, too, like Bucky Irving, you're still using that toe a lot. When it comes to the quarterback, though, a lot of pressure on your feet. You need them and the stability to make a good throw, to plant your feet. What do you think Baker might be dealing with the toe as far as a quarterback?
You know, if that's his push-off foot where he's extending his toe as he throws the ball, it can be a problem. There are some things that trainers can do to help this. Initially, it's simple things like rest, ice, compression, and elevation, but they can do some taping to help support the joint or even some shoe modification so that your toe won't extend to the same degree that it would in a softer shoe.
Now, I got to ask you, I want to transition here to Dak Prescott, Cowboys quarterback, who's dealing with the hamstring injury. He's on the IR. He's going to miss significant time here. And then this morning I was reading about the injury, and they were talking about the hamstring partially falling or tearing away from the bone. That is a heinous description in sight, Dr. Gasser.
Well, you know, we've talked about hamstrings injuries a lot in the past, and most of those injuries are at the area where the muscle and the tendon join, and those are musculotendinous injuries. So you have 3 hamstrings in the back of your leg, and they actually attach high up on your pelvis to what's called the ischium, which is the name of the bone in the pelvis. And that's actually when you're sitting in a chair, that's what you're sitting on is your ischium. So those 3 hamstring tendons attached to the bone there, while most hamstring tendons are sort of in the mid aspect of the muscle at the junction of the tendon and the muscle. Dak Prescott's injury is the rare injury where the hamstring attachment to the ischium can partially or completely pull off the bone. Those are more severe and take longer to recover. And there are some rare instances where if all 3 of those hamstrings pull off, or if 2 of those hamstrings pull off and are significantly retracted, that you would potentially consider surgically reattaching them to the bone.
Oh, my ischium. That sounds horrible. You know what it sounds like to me, Dr. Gasser, and I know a lot of people are, maybe I shouldn't do it because people are eating their breakfast. You know when you get like a good piece of meat around a bone and it's really tender and you just like kind of just scoop the meat off the bone and it just falls off that bone? Is that what it looks like?
Pretty close, except, you know, a normal tendon attachment is very hard to pull off the bone. It's only after you cook it and everything softens that you can do that with your steak. But normally those things are really firmly attached. And that takes a lot more energy to sort of avulse your hamstring off the bone. And it takes them a lot longer to heal than those typical mid-substance musculotendinous strains, which is why it's going to be a while for him.
How did he even walk after that? Like, to me, the way you're describing it and the ischium where it is, sitting on it right now, I would struggle to walk, I would think.
You know, I think it's probably because he has only a partial injury there and not a complete. If you completely do it, it's really hard to walk. He has what they described as a partial avulsion, but that could take 6 weeks to heal.
Wow.
And if he had a more severe injury, you might be looking at surgery with a 6-month healing rate.
Their season in Dallas is just falling off the tracks. They're in a lot of trouble. I want to ask you, Dr. Gasser, while we've got you here, as my mom just texted me, no, she hated that description of the hamstring falling off the bone. Pat and I were talking earlier in the week about hamstring and groin injuries, and we're seeing a lot of them here in Tampa Bay. Can the Florida heat, can that have any impact on hamstring or groin issues?
You know, it's a pretty controversial subject, but the heat can have an impact in the sense that in a hot, humid environment, you tend to get dehydrated, you sweat excessively, and that really affects the metabolic efficiency of your muscles. And in a less efficient environment, they're more likely to strain. So in that sense, yes, but heat just by itself, maybe not, because most people think of muscle tendon strains worse if you're cold and don't warm up. So I think extremes of either side can cause increasing injury.
Somebody just texted in, and he's totally right. Like, I felt like this was like ischium was a word that I learned at Hebrew school, and I'm guessing he might be Jewish like me. He said, is there a more Hebrew-sounding bone than ischium? Nate in Palmetto. I don't know, Nate. It sounds like a Hebrew word to me. I got to be honest with you. Drake London dealing with a hip issue. He was taken out of the game. He fell really awkwardly, caught the touchdown pass, fell on the hip. What could he be dealing with, and how common are a lot of these hip issues, not just with athletes, but with a lot of people?
So Drake is dealing with what's called a hip pointer. And if you look at the video of his injury, he landed right on the side of his hip, and he actually injured not his hip, but his pelvis and the other bone of your pelvis that's higher up that you think of is your iliac wing or your iliac bone. And he landed right on the bone there. And that's where a lot of muscles attached, like your abdominal muscles. And those things tend to be very painful. And as long as you can tolerate the discomfort and you have normal motion and strength, you're able to play through it. You know, hip injuries in athletes are fairly common, and they range from things like tendinitis or bursitis to more involved things such as impingement or femoral acetabular impingement, which is one of these newer things where people tend to tear some of the structures within the joint. There's something called athletic pubalgia, which is the sort of the hernia of the groin area that involves some hip structures. That's treated by general surgeons. And then even occasionally and rarely, we've seen it in the football world where you can either sublux or dislocate your hip.
I'm not an athlete. I claim to be one, but I'm not, Dr. Gasser, I know. But I play golf. I've realized, like, when I was getting out of my car today and walking into work, and I'm 34 years old, I don't think I should be feeling this. My right hip, like the upper part of my right hip, like when I get up from sitting, occasionally it just, not like a heavy pain, but it's something. Is that normal?
Well, you know, golf is really stressful on the hips from the rotation involved in the golf swing. And golfers are notorious for having some hip discomfort, whether it's muscular strains or what we call impingement in the hip. It's a pretty common thing in golfers. And I think Greg Norman was one of the first golfers that underwent an arthroscopy of his hip, which was pretty successful for him. That sort of popularized the notion of hip problems in golfers.
What, do I just ice it up, or is there anything specific people could do with this?
Yeah, stretching, icing, good warm-up. And then if it persists, you need to see a doctor and have some imaging studies and a little bit more thorough examination and workup.
Well, I know who I'm going to see. Always my friends at Florida Orthopaedic Institute in partnership with Tampa General Hospital. It's who I went to see when I was dealing with my mallet finger a couple years ago, and it's who you should see if you're dealing with any injury. I heard a little laugh there. Dr. Gasser, it was real, and it was very serious, that mallet finger, and I finally got over it. And it took a while. To access that world-class orthopedic care right here in Tampa Bay, call 1-800-FL-ORTHO or go to floridaortho.com. Steve said on the text line, Dr. Gasser, he was only listening to hear if you would say good question to me. I didn't get one today. I thought maybe on the Florida Heat impact question on the groin, but no, you just said it was a controversial issue.
Aaron, all your questions are good questions.
Thank you so much, Dr. Gasser, gassing me up right there on the way out. Dr. Gasser, always love talking to you. We'll talk with you soon here.
Sounds good. Thanks.
They are the best over there. They know their things. So if you are dealing with an injury, you know who to reach out to, Florida Orthopaedic Institute and Tampa General Hospital.